All right, we are back with central nervous system stimulants, video number 3 of the central nervous system. So the central nervous system stimulants are a pretty small group of drugs with limited therapeutic use. Therapeutic use is going to be mostly focused around attention deficit hyperactivity disorder and narcolepsy, which is defined as the uncontrollable urge to sleep. Historically, these drugs have been used for weight management. We'll kind of get into the ups and the downs of that potential use for the central nervous system stimulants. But anyway, they're used to treat conditions that arise from either decreased mental alertness or underactive central nervous system or a portion of the central nervous system. But the other thing is that these central nervous system stimulants are also widely abused. And when we think of the drugs for abuse, the ones we're going to focus on are cocaine and also amphetamines. So that's sort of where we're heading with these drugs. So the term central nervous system stimulant is a agent that will increase the excitability of the central nervous system, the whole thing. So it's not a selective drug. It is a central nervous system stimulant, increasing the excitability of the entire central nervous system. So the agents that fall under this category are amphetamines, xanthines, caffeine, theophylline, theobromine are examples of xanthines, and also cocaine and the cocaine derivatives like procaine, benzocaine, and lidocaine. Now, of that list, the only real drugs that are the only real clinical application currently is focused around amphetamines and cocaine and the cocaine derivatives, but not for their stimulant effects, instead as an adjunct to anesthesia. So we'll kind of talk about that in a little bit. Xanthines have some potential therapeutic use, but it's not very broad. So these are scheduled drugs, as I'm sure you know, if you remember from when we looked at this at the very beginning of the semester. Amphetamines, Ritalin, Adderall, those ones are Schedule II drugs. So they're way up there, which means they have a potential for an abuse and or dependence. They're central nervous system stimulants. They stimulate the entire central nervous system, so all areas of the brain. When you administer a central nervous system stimulant, what you would expect to see is signs of central nervous system stimulation, right? Above that normal or neutral line on our continuum chart that we saw in the previous video. So we should expect to see an increase in alertness, wakefulness, and a decrease in fatigue. If they're starting down below that normal or neutral line, also wouldn't be outside of the realm of possibility to see mood elevation, euphoria, an increase in initiative, which is kind of, again, all focused around the utility of these agents in the treatment of hyperactivity disorder. The downside of this is they're also, the downside or the upside, depending on the objective, is a decrease in appetite, which is why they were used as weight control, agents for weight control, although that's kind of falling out of favor, and I'm suspecting that the FDA will actually yank that approval for these amphetamines for that reason. Okay, so how they work is they stimulate the entire central nervous system. So they definitely cause an increase in norepinephrine in the brain, and that's probably what's most likely related to the stimulation, but there's some evidence that they cause an increase in dopamine and also serotonin as well. So we're seeing a lot of stimulation in all regions of the brain with the central nervous system stimulants. So as I said previously, the therapeutic uses for these drugs, these amphetamines, probably most commonly ADHD, hyperkinetic children and adults, narcolepsy, which again is the uncontrolled urge to sleep or when they're sleeping at inappropriate times, weight control, dextroamphetamine or dexedrine is the agent that was used for this or is used for this purpose, although, like I said, it's sort of fallen out of favor because it's really highly abused and it doesn't really seem to get at the root cause of obesity and weight gain, which is oftentimes psychological, and it doesn't really do that, right? It just suppresses the appetite. If someone's eating, psychologically eating, well, you know, for comfort or to fill a void, or there's any number of ways you can kind of look at that. This drug isn't going to do anything for that, right? It's going to suppress the appetite, but that's about it. These drugs also exhibit tolerance, which again, if you recall, means you have to increase the dose to maintain the effect. So it's just really, in the context of weight control, the amphetamines are really just too dangerous of a drug to use for this purpose. All right, so let's talk a tiny bit about attention deficit hyperactivity disorder. This is a situation where we have hyperactive adults and or children. It presents a little bit differently in adults and children. In children, ADD generally presents before the age of 7, but it can extend into adulthood. And it's characterized by symptoms of impulsive behavior, lack of focus, a lack of attention, hyperactivity, behavioral challenges in school, those kinds of things. That's how it kind of looks with kids. Also poor performance and a lack of interest in school and activities in school. With adults, it's a little bit different. With adults, we kind of think about workaholic tendencies, inability to maybe hold the same job, maybe emotional outbursts, problems with temper, feeling very overwhelmed, not able to stay on track, not able to complete a task, those kinds of things. Back to kids for a minute. When kids with ADD or ADHD are administered amphetamine, methylphenidate, or Adderall, either one of those are used. Both of those are very prevalent. You do see an increase in classroom improvement. They become more active. They become more focused, right? Their learning and discipline problems are alleviated to some degree. Their attention span seems to be lengthened, which is kind of weird. So when you think about giving I don't know about you, but if you're listening to this, you might be thinking like, why would you ever give a hyperactive person a CNS stimulant? It doesn't make any sense because, as we said earlier, we see an increase in motor activity, increase in sensory acuity. Well, it seems like these drugs, which are increasing norepinephrine and serotonin and potentially dopamine in the central nervous system and also stimulating the sympathetic nervous system, right? So they're sympathomimetics. Sympathetic outflow gets increased because of the norepinephrine, and their central nervous system stimulants, specifically the cerebral cortex, as well as the reticular activating system. And if you recall that conversation we had about the reticular activating system in the very first video, the reticular activating system is essentially the part of the neurons that are found along the length of the brainstem. And what the job of the reticular activating system kind of is an elaborate filter. It allows us to filter out impulses or sensory influences that are not immediately important and maybe distracting, and instead focus on what's the task at hand, if you will. And so it seems that by stimulating the reticular activating system with a drug like Ritalin or methylphenidate or Adderall, you increase the activity of the entire central nervous system, including the cerebral cortex, and also, probably most importantly, that reticular activating system. And in so doing, even though they do show signs of overstimulation, both peripherally and centrally, which we'll talk about in a minute, they seem to be focused, a little more focused, a little better at, coloring within the lines, if you will. And so for that reason, that's kind of where the utility around this drug is centered. I mentioned norepinephrine, I mentioned serotonin. There's, again, some dopamine release as well, and you can see that there was a study in 1996 that found an abnormal dopamine receptor density in 21% of the people with ADHD. I don't know how significant that really is, but There are some non-stimulant medications for attention deficit disorder, one of which is Strattera, which was approved in 2002. It is not a stimulant. Instead, it's a selective norepinephrine reuptake inhibitor. So it's really more like a antidepressant. A lot of our antidepressant medications, which we'll talk about later, utilize the tricyclic antidepressants notably, which are the drugs that we use for severe depression. They are also norepinephrine reuptake inhibitors. And because of that mechanism, there was a black box warning placed on Strattera, and that was because of an increase in suicidal ideation among children, which is also common with our antidepressants. We'll talk about those later on. So Strattera is a different kind of a drug. Just in a little bit more about Strattera, it takes a couple of weeks, like usually about a month, which is also very common with antidepressants, for someone to see improvement. But for the people who it does tend to work for, it does seem to improve focus and attentiveness and decrease the forgetfulness. So that is an option. So the ADD brain is really active. You see a lot of all that like bright purple stuff. That's a whole bunch of activity, and all that red is increased areas of activity in the brain. So we have a lot more stuff going around in that in terms of sensory information coming to the brain, and it seems like it makes it very difficult for them to be able to filter it out, I guess is the best way to think about it, and that's where these drugs potentially are useful. Okay, so let's think about side effects or toxic effects of amphetamines. So they're central nervous system stimulants. So remember that continuum chart, right? We get above euphoria and we have anxiety, nervousness, sleeplessness, those kinds of things. At a high dose, we see what looks to be like a schizophrenic picture. It's probably due to the dopamine. Increased dopamine does precipitate schizophrenic-like behavior. Also, hallucinations and paranoia are among the realm of possibility for side effects with these drugs. The cardiovascular side effects are worrisome because they're sympatomimetic, so they're going to drive the heart hard, right? Just like any drug, like a beta agonist would, right? Increase heart rate, increase blood pressure, and possibly precipitating arrhythmias because they suppress the appetite. Especially, this seems to be especially problematic with children. There's a lot of weight loss, a lot of failure to thrive, potential malnutrition because they're just not hungry and they just don't eat. In the kids, again, they're more prone to sleeplessness, so they cause anxiety, which amphetamines do anyway. Excessive crying, maybe some behavioral issues around that. I mentioned the suppression of growth. So that's probably part of the malnutrition picture. So the recommendation around that is to give kids drug holidays so they're not on the drugs all the time, especially before the epiphyseal plates close and their growth period has commenced. If they are doing drug holidays, starting and stopping, and that can look different depending on the scenario. It might be on the drugs during the school week, off the drugs on the weekend, or on the drugs during the school year and off the drugs in the summer. Adults seem to be better at just taking the drug kind of on an as needed basis, and it's not as much of an issue with adults because they're already fully grown. But by giving the drug holidays, that seems to allow for the kids to sort of catch up on their growth, and they seem overall to reach average height. One possible but not very common side effect is suppression of the bone marrow. So for that reason, they'll do periodic blood tests just to make sure that everything looks all right in that respect. Contraindications and cautions with amphetamines. So if they have insomnia or they already have psychological disorders such as suicidal tendencies or ideation or schizophrenia, chances are these drugs are not a good option for them. If they already have hypertension or cardiac arrhythmias, amphetamines are going to be contraindications. They have anorexia, or they develop anorexia, these drugs will need to be discontinued. They are scheduled drugs, Schedule 2, and they are highly abused, so that is something we need to be careful with. There's also a fair number of drug interactions. They're going to interact with anticholinergics, anticoagulants, anticonvulsants, as well as tricyclic antidepressants. If somebody is on one of those drugs, they are generally going to require a dose adjustment on one or both of the drugs in order to get the utility out of both of them. Okay, so those are central nervous system stimulants. I didn't really get into the treatment of narcolepsy, but narcolepsy is not all that common, but it is a condition where it's thought to be due to a decrease in neurotransmitters in the brain potentially, and therefore this use of a central nervous system stimulant is potentially helpful. Sleep, of course, is hugely important to probably one of the most important thing, restorative sleep. And what happens with narcolepsy is they don't really ever experience restful sleep. They have abnormal REM pattern, rapid eye movement sleep patterns, and they never really get that restorative sleep. And so the idea around that would be to keep them awake during the day and then do something to help them sleep better at night. So stimulants are used for that daytime picture. All right, another type of central nervous system stimulant that's not as potent are the xanthines. Again, this is where caffeine, which is the most potent of the xanthines, caffeine, theobromine, which was found in tea largely, and theophylline. These are examples of xanthines, and really they're very minimal in terms of therapeutic usefulness. Caffeine probably obviously is the most widely utilized of these stimulants, most likely, and it's also the most potent. You can see what the common concentration of caffeine is in different beverages, coffee. And of course the strength of the coffee and how it's prepared and all of that's going to be different. But generally, a cup of coffee has somewhere between 100 and 150 milligrams of caffeine. Tea, depending on the type of tea, anywhere from 40 to 150 milligrams of caffeine, as well as some theophylline. Coke, the kind you drink, has about 35 to 55 milligrams of caffeine. So the kinds of responses you would expect would be signs of central nervous system stimulation. So, any of us coffee drinkers, we know that with coffee we see an increase in alertness, a decrease in fatigue. That's why people like it. Caffeine is going to be the most potent, followed by theophylline, followed by theobromine in terms of the potential for CNS stimulation. Xanthines are a cardiac stimulant. Of the three, theophylline is the most potent in terms of cardiac stimulation. Theophylline is something that was historically used for bronchodilation in the treatment of asthma and or emphysema. It's not used that much anymore because we have better bronchodilators. Probably still in the context of emphysema would be the more common use of theophylline. Caffeine constricts blood vessels in the brain, and so for people who have headaches secondary to dilated blood vessels, headaches are kind of confusing to sort of figure out what's going on with them. But for some people, it seems like dilation of the blood vessels might be what causes the headache, and so caffeine helps for those particular patients. In a lot of the over-the-counter pain medications designed for headaches, especially migraine, like Excedrin migraine, for example, has both an analgesic for the pain and caffeine for the bronchodilation, or bronchoconstriction, pardon me. Xanthines do have a potential for diuresis. Theophylline, theobromine, and caffeine in that order for potency. And I mentioned the bronchorelaxation there. And again, theophylline is probably the most potent along those lines, but caffeine does bronchodilate a little bit as well. There's a drug called aminophylline, which is a more water-soluble version of theophylline, and it's a little bit better absorbed and a better choice if you're actually trying to get theophylline in there for the bronchodilation aspect in an asthmatic patient or a patient with emphysema. All right, so how they work is they are central nervous system stimulants. They increase the breakdown of cyclic AMP. They dilate bronchioles, like I mentioned, and they also dilate pulmonary blood vessels. They dilate pulmonary blood vessels, and constrict cerebral blood vessels, which I believe I just said. The other thing about xanthines that's important to note is they activate the cytochrome P450 family of enzymes, which is the family of enzymes that metabolizes most drugs. So by activating the P450 enzyme with caffeine, for example, you're going to increase your metabolism of any other drug that is also metabolized by that same family of of enzymes, of which there's lots. So it's going to potentially change the way we metabolize drugs. They're going to metabolize drugs more quickly if they're caffeine consumers. I think I mentioned this for the most part for therapeutic uses of xanthines, pain for the headache. I mentioned that bronchodilation and just the good old-fashioned countering drowsiness, right? That's why we like our coffee for the most part. In terms of side effects, it's going to be the side effects of central nervous system stimulants. This is not going to be nearly on the same scope as we saw with amphetamines. Xanthines are not nearly as potent as amphetamines in any capacity, but especially in the central nervous system stimulation capacity. But we do see some side effects that are more sympatomimetic in nature. One of which is an increase in heart rate and potentially precipitant of cardiac arrhythmias. With caffeine, we seem to see an increase in gastric secretion. So there's a little bit of a link potentially between caffeine and maybe ulcers. A little bit of diuresis, not a whole lot. If there's a large consumption of xanthines, you might see some insomnia, maybe convulsions, although that would be really unlikely. I can't imagine getting that kind of a dose in. And there are some withdrawal symptoms. The main one and the most common one is headache and irritability, and that's going to be mostly focused around caffeine because of these agents, caffeine's the only one that's really consumed with any degree of frequency currently. So that's the story with the xanthines. If somebody has an ulcer, if they have a cardiac arrhythmia, we definitely would want to be cautious. There is some evidence that in small animals with large caffeine doses, there were some birth defects. There have been no known human studies showing birth defects with caffeine. But for that reason, and kind of the general rule of thumb with pregnant women is they just stay away from it unless you absolutely have to have it, and most pregnant women can go without coffee for the duration of their pregnancy without too much trouble. You can see there's a link to a retrospective study that was published in 1993 that linked potentially, it just showed a correlation, not causation, but a correlation between caffeine consumption and an increased rate of miscarriages, and that was more than 300, and that was what the data showed was that more than 321 milligrams of caffeine a day. And if you remember, your average cup of coffee is somewhere between 100 and 150 milligrams. So we're looking at 3+ cups of coffee a day, somewhere between 2.5 and 3 cup probably. And you see a pretty small increased risk, 2.62 times the risk of miscarriage. So, a little bit of coffee is probably not going to be a big deal, but definitely should be limited, again, with the sort of general rule of thumb with our pregnant women is to just sort of steer clear unless you can't. Okay, the last thing I want to mention is cocaine. Cocaine is, of course, a central nervous system stimulant. It's a very common drug of abuse. It's much more potent even than amphetamine in the central nervous system stimulant category. But for the most part, it's going to be similar to amphetamines in terms of responses, mechanism of action, side effects, toxic effects, as well as contraindications and cautions. It's notable to say that cocaine is not approved for therapeutic use as a stimulant. right? There is no time ever, anytime soon, that you're going to be able to write a prescription or receive a prescription for cocaine in terms of central nervous system stimulation. But the cocaine derivatives are used, and they have with them oftentimes a side effect of CNS stimulation. And so that's the reason why we want to talk about them. The reason why they are approved is as a local anesthetic, as sodium channel blocker. You're probably familiar with the terms procaine, lidocaine, and benzocaine. Those are all cocaine derivatives. They are not general depressants. They are stimulants. All right, the abuse is common, as we know. It's like amphetamine, but potentially more intense on the stimulation side. So how they act in terms of local anesthetic is they act as sodium channel blockers, which block depolarization, which makes it harder to generate an action potential. So that's their utility in terms of anesthesia, local anesthesia. There's the chemical structure for procaine and lidocaine, which you are not responsible for remembering, but there it is in case you want to know. These things are administered in all different sorts of ways. There's topical applications of lidocaine. There's you can use them, do an infiltration. They're used commonly in dental procedures. There you can do a nerve block. You can do a spinal application as well as an epidural. So there's all different types of ways to administer these medications and achieve local anesthesia. Here's again how you would do that if you wanted to, and some different sorts of formulations and methods and description of the effects that you would expect to see from these different administrations of local anesthetics. Again, this is not, we're not really talking about this in our class, but I wanted to give it to you just so you have it as a sort of general idea what the difference is between infiltration and a nerve block, etc. So it's basically where you put it and where you put the needle, right? That's essentially what it all kind of comes down to for these local administrations. In terms of cocaine, I do want to talk a little bit about it. In terms of how it's acting locally, we don't really know for sure, but the sodium channel blocker seems to be a pretty good, there's at least some pretty good evidence that that's how it happens. So elevating threshold, meaning it's harder to stimulate those cells, right, by decreasing the permeability of sodium and probably other ions as well, but sodium definitely. So depending on how you're using this, right, if you're using a cocaine derivative as a local, you're going to probably potentially see some signs of central nervous system stimulation. It's going to be different from person to person. Some people are going to be more sensitive and others are not going to be as sensitive, but those symptoms would be things like anxiety, restlessness, confusion, tremors, convulsions, dizziness, those kinds of things. They might get depression later on, which is not uncommon with kind of the downward slope when somebody's coming off of stimulants, amphetamines or cocaine. Unconsciousness and death. There's some pretty significant cardiovascular ramifications for the use of cocaine, and this is outside of therapeutic use. Now we're talking about using cocaine more recreationally, if that's the word that seems to be most appropriate there. In terms of how the drug acts on the heart, is early on you get stimulation, but later on it acts as a depressant on the heart, where you'll see bradycardia, slowing of the heart rate, hypotension, potentially cardiac arrest, which is a little bit different from amphetamines. And there are some allergic reactions that are possible, but not all that common. So coronary occlusion is not uncommon with cocaine abuse, as well as endocarditis. The inside of the heart seems to be affected by cocaine abuse, and so there's a lot of myocardial infarctions as a result of this, or longstanding heart issues as a result of cocaine. Okay, so finally, our central nervous system stimulants, just as kind of summary, what we've kind of covered here. They're going to increase the activity of the entire central nervous system. That's why they're called central nervous system stimulants. The agents are the amphetamines, xanthines, cocaine, and the cocaine derivatives, with the amphetamines being the ones that with the most clinical utility. The therapeutic uses for the use of the amphetamines is going to be attention deficit disorder, ADD, ADHD, in either children or adults, narcolepsy, weight. I put a question mark because that's probably not the best way to go for the reasons we discussed. For countering drowsiness, pain for a headache, and some bronchodilation, we could say caffeine. Also theophylline for bronchodilation. And finally, the local anesthetic action is reserved for cocaine and the cocaine derivatives. So that is the central nervous system stimulants in a nutshell. Hope that made sense. In the next video, I'm going to come back and talk about central nervous system depressants and general anesthetics. I will see you then.